During unprecedented times, we have to bring unprecedented solutions, often ones we've never used before. What am I talking about today? I'm talking about the absolute decimation of private practice in this country. Whether you agree with it or not, how the federal government handled it or how state governments are handling, doesn't matter. There are 4 million cases that did not get done this month. That's right, 4 million. The United States does over 50 million elective procedures and surgeries each and every year. Let that number sink in, because that's how many patients we're missing, that's how many surgeries and procedures we're missing, and that's how much revenue we're missing. And when you look at the P&L of a private practice today, what you see on the revenue side, accountants like me like to call it gross revenue, you see a big fat goose egg, a zero. And on the expense side, you see more and more expenses incurring. Now, how do we help private practices? How do we as a collective, not just me, although it is my solution. I came up with it and I invented it. But how do we help private practices? Well, that's the simple part, but difficult. For the last 10 years, for those of you who know me, we've been talking about surgery futures and forward surgery contracts. Now seems like the right time for self-insured and self-funded employers to begin buying what they need from private practice physicians that own their own facilities or are partners in their physician-owned facilities. What does this all mean? Well, my dear friend, here's what it means. Pay attention. It means that as an employer, you can lock in the prices for about 80% of the items you utilize in a given year for the next 5 years. You can lock in those prices. Again, this is nice because the bean counters want a stable number. What they're tired of, what the American people are tired of, what everybody's tired of, is the ever-increasing expense of healthcare. So we can kind of solve the problem in one way, using forward surgery contracts and surgery futures contracts. Now, what does this mean for a physician in private practice? Private practice physician, this means that you, during the time that you're freaking out, having anxiety, and potentially going out of business, you will provide prices for the procedures and treatments that you do best. You will provide an all-in, bundled, all-inclusive, consumable, and usable price. For example, orthopedics, one of my favorite specialties because we see it all the time. Total joints, I need the price. That's all-inclusive of anesthesia, implants, facility, and professional fees. Sounds pretty simple. What else do we need? We need prices for consults. We need prices for physical therapy. We need prices for all interventional pain. We need prices for ENT. We need prices for urology. We need prices for OBGYN. We need prices for everything that's non-emergency and elective, or could be elective. We need prices for cardiology testing. Why? Why do we need these prices? Well, here you go. What we're going to do is we're going to take our current small practice with about 15,000, 20,000 contracts, and we're going to make it 300,000 and 400,000 contracts. We are going to get self-funded employers, self-insured employers, to buy directly from private practice physicians. We're going to get them to buy directly, as I said, your procedures for the next 3 to 5 years. Now, what's that going to do for you? And how's this going to happen? Well, generally a forward contract or a futures contract means that I'm obligated to do something at a future date. Let me say that again. It means that I am the buyer, obligated to do something at a future date. What does this do for a physician today? Well, it's very simple. A physician today that executes a contract with a buyer today gets a premium. So let's say that premium is 3 to 5%. You will get 3 to 5% of the price of the procedure today in cash. It's a very simple transaction. It's one that all industry uses. except for healthcare, because we're generally slow. That's okay. There's nothing like a pandemic that's ruining the entire globe for us to get our act together. So, what happens on the seller side? The seller also pays the premium, and then instead of having to get a total joint from a carrier and from a hospital with a readmission rate of 8 to 10%, they now get to use a private practice physician who does 200 or 300 of them a month, higher quality, and they get a better price. Now, what that better price is, the market will decide, but we all know that private practice physicians offer prices generally 40 to 60% less than commercial carriers. So, I don't have much more time to spend on videos. We're trying to build an exchange. The good news is there are already exchanges that are ready to take our product. Now, what does that mean? Well, it means that we are going to buy, sell, and trade the contracts that physicians, private practice only, submit, and we're going to let self-funded employers, we're going to let TPAs and reinsurance buy the contracts. Again, what does this do? For the buyers, it locks in the price. For the buyers, it stabilizes their expenses over the next 1 to 5 years, 12 to 60 months. What does it do for the seller? Well, the seller generates immediate cash flow. The seller also sees an increase in the valuation of their business and gets to live to fight another day. It seems pretty simple to do these things. And it is. We've been talking about it for more than 10 years now. However, it is only in unprecedented times that we see unprecedented action. And now, my friends, if ever, is the time for physicians to submit their prices and let us sell them to self-funded employers, and it's time for self-funded employers to kick the carriers to the can and the curb. Yeah, kick them to the curb. That's the saying. It's time for employers to kick the carriers to the curb and start working directly with private practice physicians. If you want more information, my email address is info@sanosurgery.com. info@sanosurgery.com. For more information on surgery forward contracts and surgery futures contracts, you can go to www.sano.healthcare, or you can go to www.sano.healthcare. Remember, this video is unedited. It's just my rants, but really good ones. And I'm out.